All right, so we left off on sticky wax, and remember that those pieces of sticky wax are not actually sticky until they are melted, and it sticks items together. So impression waxes are next, and these are waxes that are thermoplastic materials to obtain impressions of the oral structures. So when this wax is heated, it becomes soft to take on a new form in the patient's mouth. The first one is corrective impression wax, and this wax is used in conjunction with other impression materials in the process of taking edentulous impressions. That is the only type of impression that this will take is for an edentulous impression. This type of wax flows at mouth temperatures and is used to correct undercuts in the denture so that the denture, when it goes in and out of the mouth and is inserted or removed from the patient's mouth, it's not going to cut the patient's tissue or be uncomfortable. This material is also used to fill in voids or to develop a functional posterior palatal seal for maxillary complete denture impressions to make sure that it's not going to fall when the patient opens or closes their mouth, laughs, or yawns, or those sorts of things. That's what the posterior palatal seal is used for. Here's a look at some impression wax. So in this photograph, we have pre-formed shapes as well as sticks of this type of wax, and these are the melting ranges. So we have different types of heat that is able to melt these. And you can see on this box of impression compound, this one, it looks like it's a type 1, and it comes in the sticks. So it is melted with a flame to be able to be put around the impression tray, but then immediately it cools and it's able to be shaped and molded by the patient with muscle trimming and such. So the next material we're going to look at is bite registration wax, and this is used to produce wax bite registrations for articulation of models. These can come in preformed horseshoe shapes, often with a reinforced metal particle to provide stability of the material. So these can be done for articulation models and as well as jaw relations and removable prosthetic dentistry as well. So here we have the horseshoe-shaped bite registration wafers. These would be ran under warm water or put in a warm water bath to soften, place in the patient's mouth. You can blow some air with a 3-way onto it to kind of harden it back up and then remove it carefully from the patient's mouth to reduce the chance of distortion. This type of wax is called alu wax, and it does actually have aluminum particles in it. It's a greenish type of material. It's very soft when it is warmed, very brittle in the sheet. It will break very easily, and this is something that is used very prevalently in our area for bite registrations for dentures. This little pink horseshoe at the bottom is a piece that would go onto that base plate wax that would do jaw relations for removable dentures as well. So this would have those little notches put in it to record the height of the teeth. Then this type of wax would be melted onto it and then record the relationship of the maxilla and the mandible. Manipulation of all waxes should be remembered that it should be softened evenly in dry heat. It can be softened with warm hands in a warm water bath or by using a flame. If a wax is softened by a flame, it should be rotated above the flame so that it evenly softens or flows. Melted wax should be added in layers onto an object if you want to build upon it. And if distortion of the wax is to be avoided, they should be stored at or slightly below room temperature. The lost wax technique has been used for centuries to construct everything from jewelry to dental crowns. This technique was developed as a way to cast gold. The lost wax technique basically involves the buildup of the unit in wax to an exact replica of the desired crown or substructure. This is how many artisans also make jewelry, is by doing this lost wax technique. So the primary steps in the lost wax and casting procedure are as follows. we pour the dye. So you simply pour the impression in with a gypsum product. You wax the dye by taking it out, the gypsum product out. We make the dye and then add wax to it to look like a tooth. Then we add a sprue to the dye and attach the base of the tree to the sprue, and then we invest the wax pattern by placing some gypsum into that pattern again. Then there's a whole process of burning out the wax to create a hollow pattern for the metal to go into, which is going to be called the casting. So once the wax is burned out, there is a centrifuge that the metal is liquefied, and then it is spun, and then it goes through the sprue into the hollow pattern that was created by the burned out wax. And then finally, the restoration is polished and made to look more like a tooth. So here is a picture from your book, and we have the pattern at the top that is attached to the plaster dye. Once that wax is built up and carved and made to look like a tooth, then there is a sprue. This is like a little straw that's added to it, and it is connected to a base. And the videos that you watch, you'll see one that is from a jewelry maker and the other one is from a dental lab, and how that sprue is connected, and it allows the metal to go into the form that the wax had created. So we have our pattern connected to the sprue, and then we invest it with a gypsum product. So we pour plaster over the top of this. Once the plaster sets, we place it in a kiln, and the wax is burned out. So it melts, it evaporates because of the high temperature for a very long period of time, and the wax is now gone. So that's where we talk about the excess residue needing to be removed from that pattern. Then we go to the casting. So once the burnout is complete, the wax is completely gone, we are able to melt the metal in a crucible at a high temperature using a torch or some other method to heat it. And then in the centrifuge is the little pellet that was melted, and it spins and it goes through the sprue into that pattern space, and it creates the crown. Then the operator will remove the sprue from the casting, and they will begin to polish it and finish it and make it look like a tooth. So the summary for this lecture is the dental auxiliary may have the occasion to use dental waxes in a variety of clinical and laboratory procedures, which makes a basic knowledge and understanding of the material important. Although waxes have inherent disadvantages in dimensional stability and control of flow, they may be used successfully in dentistry. The operator must keep in mind the limitations of each wax to use it to its best advantage. If you have any questions whatsoever, please let me know. Make sure that you watch the 2 videos that go with this wax lecture. And like I said, one is a jewelry maker making a whole bunch of rings and trinkets, and the other one is actually a very short video that looks at making a crown from a typodont. So maybe watch the jewelry maker first, because that person explains the whole process, where the crown is just pictures of them doing the operation. So take a look at those videos and see how that is done. It's pretty remarkable that they've been doing this type of burnout and this type of process for centuries.